Happy Friday, guys. I'm not gonna lie, I am wore out, but I will still do my very best to give you an action-packed presentation on the skeletal system. So let's start at the beginning. There are 206 bones in the human body, but when you were born, most of these bones weren't exactly bone just yet. You were made out of a soft, squishy substance called cartilage. And cartilage is what enables us to be born, right? Imagine birth if this wasn't all nice and soft, you know what I'm saying? And it is the action of the osteoblast that little by little turn the cartilaginous tissues into bone that is more durable and hard and protective and so forth, right? But you still have some little remnants of cartilage that remain that are obvious, like in your, in the front of your nose and your ears and so forth, okay? Now, again, 206 bones that are divided into two divisions. The head and trunk make up the axial skeleton, whereas the appendages, the arms and the legs, of course, make up the appendicular skeleton. So that's easy enough. Appendages, appendicular, you get it, got it, good. All right. So now let's start going through the actual bones, all right? So, the skull. There are 22 skull bones. And if you look up here at the cranium bones actually correspond with the lobes of the brain. So just like how you have a frontal lobe, you have a frontal bone. Just like how you have two parietal lobes, you have two parietal bones. You have two temporal bones. And way in the back, you have your occipital bone. Of course, the occipital bone, as you've caught on now, the occipital bone is what corresponds with the lobe in the back of the brain called the occipital lobe. So there you have the cranial bones. Let's see, right here, you have all these sinus bones, which are actually rather difficult to get to know. But I'll say it like this. The sinus bones, a lot of them have really silly words like ethmoid bone and sphenoid bone. But yeah, there's that. And of course, then you have your jaw bones, which are your mandible and maxilla. And before I forget, the smallest bones in the body are deep inside that ear. You have your ear ossicles, which vibrate and have a role with hearing. And that almost does it for the skull, but there's one other special one I want to show you. Oop, that might be graphic for YouTube, but I have to show it. This one right here, it's a weird little bone back there. That's where your tongue anchors on, and that's called the hyoid bone. So, well, okay, that's good enough. Sorry, Bob. All right, so that's the skull. Now let's do the shoulder complex. So you have your clavicle and scapula, and they kind of unite right here at the sternum or chest bone. And you'll notice all the ribs. You have 24 ribs, and each rib up here, these top several ribs, unite with the sternum individually. You see that? So if there is an individual unification at the sternum, those are called true ribs. Whereas the ribs over here kind of all come together, they converge before they hit the sternum. Those are called false ribs. So true ribs and false ribs. But I'm not done with the ribs. You'll see some back here, there we go. They don't unite at the sternum at all. See, no unification at the sternum. Those are called floating ribs. So floating ribs, false ribs, and true ribs. And there's your sternum, and there's the shoulder complex made up of the clavicle and scapula. Okay, let's move on to the arm. So I have your funny bone. So if you get hit there in that elbow, it's not really funny, but that's called the humerus. And then the distal arm is made up of the radius and ulna. And then I have my hand bones and wrist bones and whatnot. These are called your carpals. So people who type a lot, you've heard of carpal tunnel syndrome, perhaps. Finally, you get to the fingers. The fingers are called phalanges. Okay, we're moving along. Let's go to the back over here. Now we have the vertebral column. So you have all these little bones. Each one of these is a separate bone, which of course each one contributes to that number of 206, like I said earlier. So how do you learn all of these bones? Okay, so the ones up here, these are called your cervical vertebrae. Okay, and then, these are your cervical vertebrae. I'm sorry, I'm just kind of poking the drumstick around at random. Then you have your thoracic vertebrae, finally the lumbar vertebrae. Cervical, thoracic, lumbar. How do you remember which ones are which? Well, let me ask you this, guys. What time of day does the average American eat breakfast? The average American eats breakfast at 7 a.m. So I have C1, C2, C3, C4, C5, C6, C7. Bam. What time of day does the average American eat lunch? So you say noon or 12. So I have T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. Thoracic, T1 through 12. What time of day does the average American eat dinner? Well, let's just say 5. So that would be my lumbar, L1, L2, L3, L4, L5. Pretty cool, huh? So I have L1 through L5 for lumbar, T1 through T12 for thoracic, and of course cervical, C1 through C7. If somebody gets a lumbar puncture or spinal tap, that's dealing with this part of the vertebral column, okay? And if anybody out there is perhaps interested in med school, the little hint here will help you out. 7, 12, and 5. Now we have the pelvic girdle, which is made up of the ilium and ischium, all right? I have the sacrum and the coccyx, that's your little funny bone, all right? And then I have the largest bone in the human body, the femur. And one of the things about these bones is once you start learning names in anatomy, you'll notice a lot of the words sort of kind of repeat. So I have a femur, in other words, but the artery that runs through here is called the femoral artery. So femur, femoral, there's a little hint for you, okay? Now let me just touch base over here. At the distal leg, we have the tibia and fibula. Then I have this heel bone, which is called the calcaneus. Okay, tibia and fibula, femur, calcaneus. And just like how my hands, I had carpals with feet, I have tarsals and metatarsals. But when you get to the toes, guys, get the same names as your fingers. So they're called phalanges. Phalanges, tarsals and metatarsals, calcaneus, the heel bone, the tibia and fibula. And let's move along here. You know, forgive me for getting you all dizzy. Here we go, the patella, right? That's your kneecap, which brings me over to this little area. This is the left knee. That's what I wanted to show you here. So besides bones, you also have tendons, which connect muscle to bone. You have cartilage, which is there for cushion. I mentioned some cartilage earlier. And finally, ligaments, which connect bone to bone. So let's just say this is the left knee complex right here, okay? In the back of the knee, I've got this PCL, the posterior cruciate ligament. In front of that, I have the anterior cruciate ligament, or ACL. This one right here is the medial collateral ligament. Sometimes when guys hear the word medial, that's better. When they hear the word medial, they think it's in the middle of the knee, but in fact, it's in the middle of the body. So it's toward the middle of the body. So remember, this is the left knee. And then on this side, there we go, I've got the LCL, or lateral collateral ligament. And once again, this is the patella, kneecap, and this little bluish grayish area represents the patellar cartilage. So sometimes when people get runner's knee, that's what's wearing away a little bit, and that's why supplements like glucosamine and chondroitin work so well. The last thing I wanted to show you, this is a little piece of a cow femur, and this is near the joint, the epiphysis. So you see the spongy bone, right? It's porous, the spongy bone, and then toward the diaphysis, or the, where you see it's more solid, that is called compact bone. So that was about it. Let me kind of zoom in to Bob's crooked jaw face one last time. I hope you have a great weekend, guys. And if anything, remember that little hint for the vertebral column, the 7, 12, and 5. Until next time, boys, peace out and God bless.